I'm Divaka Perera. I'm a professor of cardiology at King's College London, and my colleague is Dr. Matthew Ryan, who's a clinical lecturer at King's College London. And we're both delighted to have been asked to write this chapter on revascularization in patients with impaired left ventricular function. Now, you might be wondering why this chapter and why now? Well, it's because having had decades of anecdotal practice without evidence to back it, we now have two randomized controlled trials, the last of which was published and presented at ESC last year, two randomized controlled trials to guide our practice. So it's a very exciting time for us to be writing this chapter and bringing things together. And Matt, perhaps would you mind summarizing what we have gone through in the chapter?
Yeah, of course. Thanks, Divaka. So the chapter broadly splits into two sections. The first discusses which patients with low left ventricular ejection fraction should undergo revascularization. We start off talking about which patients should undergo bypass surgery, and that now is really informed by data from the STITCH trial. STITCH, as you may know, reported about an 18-month additional survival in the overall population, and so a good prognostic benefit to bypass surgery in these patients. But looking at some of the sub-analyses, perhaps restricted more to the younger patients, those with lots of coronary disease, and those with particularly low left ventricular ejection fraction. And also we need to be aware that there was a significant morbidity and mortality with up to 10% of patients suffering early harm. So good evidence for revascularization with bypass surgery, but in carefully selected patients. The other method of revascularization is, of course, with PCI, and the Revive BSIS-2 trial, which Divaka talked about, which published at ESC, looked at PCI versus medical therapy in these patients and clearly showed no benefit to a routine strategy of PCI in patients with left ventricular impairment, extensive coronary disease, and myocardial viability, and therefore showing that PCI should not be offered to these patients specifically to improve heart failure outcomes or left ventricular ejection fraction. Angina is, of course, remains an important indication for revascularization, as do patients with a recent acute coronary syndrome. The second half of the chapter then goes on to discuss how can we then safely revascularize these patients who do have an indication for revascularization. There's a short section on management of bypass surgery, specific really to the cardiologist in terms of perioperative management and getting these patients through safely, acknowledging the high risk. And then finally, we come on to safely managing patients through percutaneous coronary intervention, again, looking at pre-procedure management, management during the procedure, and post-procedure management. And here we take a specific look at the role of mechanical circulatory support, which, while it's not the only aspect of carefully managing these patients through the procedure, is increasingly important, and again, the subject of recent and ongoing randomized controlled trials to try and inform our best practice. And Divaka, I'll hand back over to you, if okay, to talk about that ongoing research and that new data which will be emerging.
Great, thanks, Matt. So what we have done, in addition to summarizing this evidence and looking at it critically, is to provide readers with a flowchart that most institutions and individuals can use once they're faced with a patient who has poor left ventricular function and lots of coronary artery disease. And what we've also done is to give you a glimpse into the future. What might be coming? What are the questions that remain unanswered despite having lots of two big trials? And two of these areas are, as you said, Matt, mechanical circulatory support. Exciting time with two big randomized controlled trials underway. And also the question of bypass surgery versus PCI. Do we know the answer? And if we don't, how can we arrive at this answer? We've given you some data on the new trials that are underway. So I hope you'll all find this a useful resource as a summary of evidence and also a summary of the questions that remain unanswered.